Last count, we had 23 public speakers. I will need to limit everybody to no more than 2 minutes. Because of that, the departmental budgets that were scheduled to start at 11, I'm estimating will probably not start much before 11:30. So just so those department heads that are here know that. Okay, Mr. Allen, why don't you go ahead and we'll start hearing from the public.
Our first speaker is Deborah McCoy, to be followed by Sharon Rose.
Deborah McCoy. Good morning.
Good morning. My name is Debbie McCoy. I am a registered nurse and Trisha's mother. Trisha grew up in Santa Barbara, went to school here, graduated from San Marcos in 2009, and will be 21 in September. 2 years ago, she developed mental illness, and her father and I tried to make several attempts to get her help, but she refused to take any medication because she does not believe that she is sick. So why would she? Back in March, my daughter felt she needed a car, went to Toyota, and shortly afterwards, she drove away in a car. She thought it was a gift, and that gift ended up meaning after Toyota called the police, she was given 6 weeks in isolation, in an isolation cell at our county jail, 4 weeks at the PUF unit, and so far 3 weeks at Patton State Hospital. Last evening when we spoke, she reported that she is housed with, quote, bangers, druggies, and thugs. Everything that I never wanted to be, Mom, end quote. She is the youngest patient on the ward and probably has the shortest rap sheet of anyone housed there. At the transition between jail and PUF, we waited 4 days before she could be transferred because the PUF unit had no beds. When we were in court on May 25th, only 19 days ago, a county employee informed Judge Anderson in open court that the PUF needed Trisha's bed as soon as possible because there were 5 inmates in the county jail and 10 others in various emergency rooms across the county who all needed her bed. Imagine 16 people fighting for this very same bed. I have to say, my concern doesn't end with just acute care beds. What's Trisha going to do when she comes back to Santa Barbara? Where will she go?
Thank you so much for your testimony.
We just need beds. Thank you.
Sharon Rose, to be followed by Rob Fredericks.
Good morning. My name is Sharon Rose. I'm executive director of a small nonprofit agency. I had a 20-year career in public health program management, during which time I had to watch my bipolar son go successively downhill over and over again until he almost died, until a caring residential rehab program saved him. We cannot allow those who need help to continue to be put in jail. At many times, 70 to 80% of the jail population is made up with people with not only bipolar but behavioral problems. I have a background in prevention, public health prevention. When people were getting sick from waterborne diseases, public health and government passed clean water laws to reduce disease later. This is known as harm reduction. Prevention is the answer. After the first disastrous oil spill off Santa Barbara's coast devastated our marine life as well as our economy, we learned an important lesson that oil and gas revenues, while lucrative, could not solve all our fiscal problems. After the BP oil spill, we have again been reminded of that same truth. Families Act is working with housing groups, with cities, and with others to build a collaborative to help you solve this problem. We don't expect the county to do it all. We have to find a way to invest that cost savings, that 25% we learned about, that treatment is cheaper than jail. We need to find a way to invest that up front, working with cities, donors, the private and nonprofit sectors. We want to work with you. We want to be at the table to help solve this problem. Thank you.
Thank you.
Rob Fredericks, to be followed by Margaret Crouch.
Good morning, Chair Farr and Supervisors. I'm the Deputy Director of the Housing Authority of the City of Santa Barbara, and I'm here today to implore you not to reduce homeless-related contracts and services with ADMHS. I appreciate Dr. Dietrich's efforts to plug some of the holes, but I ask you to give clear direction to staff to hold the line. Nonprofit and public agencies such as ours have committed to reducing homelessness and have leveraged existing resources to the best of our collective abilities. We can provide housing, but we rely on public agencies such as ADMHS to supply the needed services they are charged with providing to the vulnerable populations. On a weekly, if not daily basis, we encountered individuals struggling with homelessness. Without the necessary services offered by the shelters and service providers, the problem will only get worse. It is hard enough as it is to get people properly connected in the pipeline of housing and services. As we know from the Common Ground Vulnerability Index data, 55% of our county's homeless self-reported a history of mental illness, and 45% reported alcohol, substance abuse, probably from self-medicating. If we are going to effectively address homelessness in our community, services such as those offered in our shelters and psychiatric facilities need to be expanded, not reduced. We know from our Common Ground housing placement effort that treatment is a vital component to linking people to permanent supportive housing and helping them stay housed. I urge you not to reduce the current contracts and services, as this would be detrimental to what we as a community are trying to achieve. In fact, I would like us to take the opportunity during these budget hearings to look at the homeless services reorganization that Chair Farr talked about. We are truly developing the collective impact approach that Thrive offers, and as Supervisor Lavanino mentioned, these collective impacts don't provide the scattergun approach. They provide a laser approach to solving the issues, and that's what we want to do. Thank you.
Thank you, Mr. Fredericks.
Margaret Crouch, to be followed by Michael Foley.
Good morning, Madam Chair, members of the board. I want to speak to lots of issues, but I'll just try to be general. I'm here as a mother. My son has a serious mental illness, and so does my older sister, so I'm well acquainted with that aspect of life. There are many proclamations about service to the community, but where is service to the community when budget cuts eliminate services to the most vulnerable in our community, people with behavioral and mental health issues? We need to maintain our shelters, not reduce them. We need to support their activities. We need to keep the numbers of psychiatric beds available and hopefully increase them. We need to keep the psychiatric health facility open. We need to keep the programs going. We need to continue to provide veterans with services that help them with their mental health issues. There are many people who need and use these programs. And because the programs and facilities, beds and treatment centers are there, these people can restructure their lives and become active and productive members of the community they live in. So let's stop taking their chances away. Let's give them a chance to have a joyful, happy life. Isn't that what we all want? Thank you.
Thank you.
Our next speaker is Michael Foley, to be followed by Darla Kaiser.
Chair Farr, members of the board, I'm representing Casa Esperanza today. First of all, I want to thank all the staff in the CEO's office and in the Department of Mental Health for working to find a way to save the homeless service projects that are operated by ADMHS. What we would ask is that you be sure that by Friday when you approve the budget, that you have a lock on that. At this moment, it's not a lock. It would be great if it was, before you finish. I did want to talk about what is missing, though, and that is There are huge cuts still proposed to the psychiatric hospitalization system, and those are cuts on top of what can only be described as a disaster. At this moment, there are people sitting in emergency room beds, protected only by a curtain and pumped full of drugs while they wait to get into a psychiatric hospital. Imagine if that was your brother. Imagine if that was your father or your mother or your child, needing psychiatric hospitalization but waiting behind a curtain in an emergency bed. What you have before you is more of that, not less of that. There's got to be a solution to that. And as you consider that solution, I would just encourage you to do a little bit more investigation into the budget itself for ADMHS. And this is just my read from what I could see because it wasn't addressed. I see a $500,000 increase in administrative costs and an increase of 10 administrative positions, and a decrease of just about $800,000 in the QA compliance line, but an increase of 0.6 FTEs. It seems to me that if we're going to continue this hospitalization policy that's not working, we should make sure that that budget is so tight that there's nothing else that you can do. Thank you.
Thank you, Mr. Foley. Yeah, Supervisor
I'm
Gray?
sorry, I have a question for Mr. Foley.
Mr. Foley, if you'd return to the podium, please.
Mr. Foley, on the emergency room waiting type issue that you just addressed, does it have to be a hospital bed, or is there another kind of bed? Because I wrote hospital and I thought, I'm not sure that's what you were saying.
I only know what happens, and that's when somebody is placed on a 5150 hold because they are a danger to themselves or others. They need to go to a psychiatric hospital where they get assessed for up to a 72-hour period. When those beds are full, what's happening right now is they're being taken to the emergency room. So I worked with a woman who is 74 years old. The system completely broke down for her in her assisted living center. She came to Casa Esperanza, and after many days, we finally got her assessed and assessed that she needed a 5150 hold because she was a mental health client. She was taken to Cottage Hospital, where she sat behind a curtain for 3 days before she got into the psychiatric hospital, and the person sitting next to her had been there for 7 days. And that's what's happening every single day.
Thank you.
Darla Kaiser, to be followed by Leah Juniper.
Oops. Hello, Madam Chair and the rest of the supervisors. I'm going to talk about the need to stop the cuts to acute acute psychiatric inpatient beds. My name is Darla Kaiser, and I am the Executive Director of the Consumer Advocacy Coalition. The Consumer Advocacy Coalition is by, for, and about those with mental health challenges. 2 years ago, we saw that the beds at Vista Del Mar and Ventura were cut from 12 to 5, Vista Del Mar being a psychiatric hospital. 2 years ago, we saw, now there are only 3 beds at Vista Del Mar available. The lack of beds create hours of waiting in the emergency room when people are in acute crisis. I was informed that in Ventura, a place called Hillmount is being used because they accept Medi-Cal, and the Vista Del Mar does not. Hillmount is worse than the psychiatric health facility, which is referred to as PUF. Neither the PUF or Hillmount are a place of healing. I know this from personal experience by staying at Vista Del Mar and PUF. Recently, I had a crisis but refused to be hospitalized because I did not want to end at Hillmount or PUF. Because I have no health insurance, I have limited options where I would stay. I felt that I'd rather die than end up in those places. I had to promise my roommate that I would not kill myself during the weekend. PUF and Hillmount are not healing places, but merely holding tanks for the mentally ill. People with mental health challenges are put in a precarious position. This is not fair to those who are in a crisis situation. I ask you not to only stop sending people to Hillmount, but to restore the 12 beds at Vista Del Mar. I am tired of alcohol, drugs, and mental health services trying to fix their budget by cutting direct services to the mentally ill. Thank you.
Thank you, Ms. Kaiser.
Our next speaker is Leah Juniper, to be followed by Robin Barber. we could go ahead if you'd like to just. Yeah, we'll just go with. Well, Robin Barber, and then we'll come back to Leah Juniper.
Thank you. I just want to be sure that we also echo the concern around any reductions in the PUF area. That's a great concern to the employees as well as to SEIU. One of the things I did want to address really quickly is the proposed decision around closing the radiology department. There was some great concern in regards to that, not only from the employees that work there, but also from the public health nurses, the VA doctors, and some of the specialty doctors as well. And I wanted to be sure that the board took into consideration the transportation impact to the people that it serves, where the bus stop's right in front, right there where it is. There's clinics right there, and they can get all of their services there without having to relocate or go someplace else. I'm not quite sure what the plan is. We've asked for information around that and haven't gotten it yet, so if that is taken into consideration, that would be great. The costs as well, sometimes the charges are reduced at our facilities or than if it was contracted to someplace else. Consider the safety to the public of not having a TB screening right there where a lot of our homeless population goes. The homeless population is greater here. It's different than in North County. There's the ortho and hand clinic and other specialty clinics that utilize that in the veterans population, and also the equipment and what's going to happen with it. Right now it passes inspection. In 2008 there were upgrades. This closure would just mitigate that altogether. I mean, it would just eliminate those costs that were put forward for that. So we're asking that you look very closely at the closure of that and the impact to the community and the people that it serves, because there are people who actually don't have the resources in order to go to different places, and everything is right there, and it also helps our employees who may have exposure. They can have immediate response to x-ray at that time. Thank you for your time.
Thank you.
Here I come.
Leah Juniper, and then we'll go with Sylvia Bernard.
I apologize for needing to dig for my glasses. It's my life. I'm Leah Juniper. I'm Deputy Director for the Consumer Advocacy Coalition, and good morning to Chairperson Farr and the rest of the Board of Supervisors. And I find it incomprehensible that cuts to the psychiatric beds are being considered. The only options to folks without insurance are PUF and Hillmont and Ventura, and I do not see either of these as viable options. These are not healing places. I have been in Vista Del Mar, and I find it a very productive and healing place. Unfortunately, they do not take Medi-Cal. Therefore, folks are shipped off to Hillmont, which is a very depressing place. I invite you all to do a surprise visit to there. All I can say is please increase the number of beds to Vista. It is what we, the mentally challenged, need. Thank you very much.
Thank you.
Sylvia Bernard, to be followed by Lou Trega.
Good morning, Board of Supervisors. I am here to oppose the cuts to the homeless services through ADMHS, and as I appreciate Dr. Dietrich's creativity and willingness to be able to not have those cuts happen, I'm still going to move forward with my comments today. Good Samaritan is already facing an accepted cut of $125,000 for this fiscal year out of the alcohol and drug program side of the ADMHS contract, which is the loss of a $200,000 SAMHSA contract that we had from last year through ADP. That is for the Lompoc services for perinatal women and children that need drug and alcohol treatment and residential services. We've already accepted that $125,000 cut. We know that ADMHS has faced significant cuts over the years, and we understand that we have also had to take cuts in the past years, including this $125,000, which is not before you today. We have already received more than 30% of cuts from the alcohol and drug program side in the last 3 years. The funding from ADMHS for homeless contracts, which is the funding cuts that were proposed today, provides 1 full-time mental health therapist and pays for 4 shelter beds. Based on our numbers, Good Samaritan ran our numbers on our shelter campus at Santa Maria alone, and from July 1st of last year, which is of 2011 to current, we provided 16,763 bed days for people that had mental health issues, and that for us is not just individuals, it's also children. We have a number of children that have mental health issues within our system. That actually equates to 280 unduplicated clients this year alone. That's an average of 46 beds. Our contract with ADMHS is for 4 beds. So we don't get to bed number 5, 6, 7, 35, 42 and say, oh, I'm sorry, our first 4 beds are full. We take everybody. That's what we do. We're Good Samaritan. That's how we provide services. Good Samaritan wants to continue to provide services to the homeless and indigent, but we don't want to turn people away based on funding limitations and have to close down our shelter beds at this point, and that's, at this point, is what we're facing.
Thank you, Ms. Bernard.
Okay, thank you.
Yes,
You
Supervisor
started
Gray.
oh, I'm sorry. You started to talk about number of beds, and I got lost, so could you just...
So from July 1st of this year, 2011, this fiscal year till current, we have provided 16,763 shelter bed days to individuals that have mental health issues.
In Lompoc or Lompoc and Santa Maria?
Santa Maria alone, in one shelter campus. And that is at 280 unduplicated clients receive those services. So thank you.
Thank you. Thank you for being here.
Lou Traga, to be followed by Emily Allen.
Members of the board, Madam Chair, my name is Lou Traga. I work for Independent Living Resource Center. I'm their systems change advocate. As I stand here before you today, I am reminded of thousands of consumers that we serve on a continuous basis around the year, and how heavily they depend on these very programs and services that are subject to potential cuts and eliminations. ILRC recognizes that this honorable body has to consider some difficult decisions and make prudent choices in allocating resources. However, we believe that these potential cuts and or eliminations of these services would endanger independent living for people with disabilities. We strongly support the continuation of the funding for these programs and services. These programs are extremely important to people with disabilities. Their services are absolutely essential to maintaining their health, their independence, and community participation of these individuals. I heard your comments throughout the proceedings, and I appreciate your support. And I hope that all of you will continue supporting people with disabilities and their independent living. Thank you very much, and I hope you take our considerations. Thank you.
Thank you.
Emily Allen, to be followed by Susan Reed.
Good morning, Chair Farr, supervisors. My name is Emily Allen with the Homeless Education and Legal Project of Legal Aid. And of course, I'm happy about the restoration of funding to homeless services. However, I'm still very concerned about the reduction in acute psychiatric health beds. Already, people are waiting too long to receive the appropriate level of mental health care. They are waiting too long in our jails and our hospitals. They are waiting too long for people who are in acute psychiatric crisis. We should only even consider reducing these beds if there is an increase in voluntary beds, like at the Crisis Residential Program in North County. Many of the people in this room have been coming to you for many years and talking about their complaints with ADMHS. I would like to say at this time, I'm personally seeing more collaboration, more responsiveness. But this shouldn't be about your understandable frustration with bad billing practices. This should be about people who are in crisis and what we can do to create a more comprehensive and seamless system of care. Thank you very much.
Thank you.
Susan Reed, to be followed by Deborah McRoberts.
Good morning. My name is Susan Reed. I am a mom and an advocate for the mentally ill. I am here today to explain why we cannot cut funds for beds so desperately needed for our critically mentally ill. My 36-year-old son, John, is schizophrenic. Until recently, John was highly functional. Sorry, I'm getting very emotional. Please forgive me. Living independently. He does not drink or take street drugs. John is a beautiful, wonderful, loving, kind son. If you met him today, you would just want to hug him. And I love him dearly. You have probably seen my son John on the streets pushing a cart with his headset on, with all of his worldly goods. Recently, John's illness took a turn for the worse, and he was unable to live independently. He ended up living on the streets, pushing this cart around. About 2 weeks ago, John became critically ill. I rushed him to Cottage Hospital, where he was diagnosed with a superinfection. He was in ICU for a day and a half and then spent the three and a half more days in a hospital bed. I called the PUF unit, where John is a client of the county mental health. I called the PUF unit to inform them John was treated for his life-threatening infection. But he needed a bed for his acute psychosis. My son has not been med compliant. He has been taking his medication. I was assured that my son would be discharged, that would not be discharged into the streets. That never happened.
I'm sorry, Ms. Reed, I'm going to need you to wrap up.
Okay. Finally, my son did not get a bed. There were no beds available. He was discharged into the streets. So I'm hoping that you will not cut beds for children like mine and others. Thank you very much.
Thank you. Thank you for being here.
Sorry I went over time.
Deborah McRoberts, to be followed by Suzanne Riordan.
First, I want to thank you for serving this community. My name is Deborah McRoberts. I've dealt with my son's dual diagnosis for 15 years now. David is diagnosed with schizophrenia, and he is also one of the bravest and strongest persons I know. He deals daily with thoughts and emotions that no one would ever choose to have, and has for years now. When he was 22, we looked long and hard for professional help. Being an ultrasonographer and a radiologic technologist working at Cottage Hospital for 20 years, I thought that I could navigate the medical world and find him the help he needed. But instead, I found a really shocking lack of psychiatrists in Santa Barbara. I could not find one person, one psychiatrist with an opening for a new patient. David would often go to the emergency room in a crisis, but the ER is not set up for long-term treatment. It's expensive, crowded, and bogged down with rules and regulations. Heroin happens to be a great antipsychotic drug, so often he would find himself self-medicating for relief, even when I know he desperately wants to be clean and sober. Why is it that our mentally ill have no one to call, even when they're legally considered mentally ill? Our jails are crowded with our mentally ill, challenged daughters and sons. According to the county's own report, 72% of those in jail are either mentally ill or substance abusers. And then after being jailed and having made no decisions in a long time, they're often released in the middle of the night without a treatment plan, with no supervision or support, without guidance. They've probably lost their place to live, they have no job, and then we wonder why there's a high recidivism rate. We need a new treatment center. We need a treatment center with job training, beds, and maybe that before a new jail. Thank you.
Thank you.
Suzanne Riordan, to be followed by Linda Schad.
Good morning, Chair Farr and members of the board. My message today is that it's time for radical leadership, radical innovation, and radical collaboration. We need to create a true continuum of care despite all of the problems that we're having. There are two, from our point of view, there are two most gaping holes in our continuum of care. The one is for acute psychiatric beds, which you've heard about a lot this morning. The second one is for intensive residential treatment. You can only stay in a psychiatric bed for so many days, and it's a very expensive thing. What are you going to do when you come out? What are you going to do instead of going to jail, because so many people don't belong in our jails? One gap tends to widen another. So there's a continuum that we have to look at. And we, as grassroots, members of the grassroots, members of families in this community that are highly impacted, we want to be part of the solution. From now on, we want to be at the table with Chandra Waller. We want to be at the table when you guys are making decisions about how you're going to fix this problem, because we need to be at the table. And we've thought about it long and hard, and our kids have died, and we're suffering terribly, okay? And we have ideas. And we naively thought, okay, when we started out and we started the task force on co-occurring disorders, that the experts would figure it out, but they haven't figured it out because they're too busy dealing with their own department or their own program. At this point, we are becoming experts ourselves. We're having to. We're meeting with housing developers. We're going all the way to San Francisco to study how Delancey Street is able to help so many people with addiction issues without taking any government money. We're very concerned about two groups of people. The one group qualifies for disability, whether or not they're on it, because they have a severe and persistent mental illness. The other group may not qualify for disability, but is equally disabled in their addiction or their behavioral issues, which stem from mental health and emotional problems. So the solutions are different for both.
Thank you, Ms. Riordan.
Thank you very much.
Linda Shaw, to be followed by Meredith McCurdy.
Good morning again. Hopefully I've not lost my voice completely again. Sorry. Thank you so much for your attention to this monumental problem. We started coming to the meetings months ago, truly encouraged by the sound of the funds coming from AB 109 and 63 and what the drug courts were doing and the restoration courts were doing. And I don't know how many of you have actually attended the restoration courts and drug courts, but they're constantly having to turn people away or leave them in jail because of a lack of beds, facilities for the people to migrate out of jail and get the treatment and assistance that they need. Last month, I was truly disheartened by the report saying that they had set aside $500,000 just to study the results of the funds spent, and yet only $300,000 was going to be actually spent on beds. To me, this is very strange thinking. If you don't fund a program that can succeed, why bother to spend $500,000 making a report to say it didn't work? Then how are we ever going to get funds for the next year? We need to build funds, we need to have beds, we need to have a system in place, a collaborative system, not just all on your shoulders, but to have philanthropists, public funds, private funds working together. We need a major change in thinking, because what we've done in the past is not working. We need to treat these people. They're not lepers. They're not subclass citizens. They're people in pain, and we need to address their pain.
Thank you.
Meredith McCurdy, to be followed by McNeil Sari.
Good morning, Chairwoman Farr and members of the board. My name is Meredith McCurdy. I'm a Rotarian, a bookkeeper, and a mom. My son moved in with his father when he was 18 in the San Fernando Valley. Several months later, two men broke in, murdered his father within his hearing, and stabbed Brian and left him for dead. He's been suffering with PTSD ever since. He was incarcerated last year. There is a gap between prisoners with mental health issues and a bed to go to upon release, resulting in chronic recidivism. Here's an example. My son was recently incarcerated last August. He was diagnosed as bipolar and given medication for that issue, lithium, I believe. He was released on May 11th and instructed by the court to stay at the rescue mission for a few days until there was a bed available at Casa Esperanza. I stated to the court that I would transport him upon his release. I made myself available and waited by the phone for a call to pick him up. He called me at approximately 9:30 the following morning. He had been released at 2 a.m. from jail without any medication. He did not go to the mission, talk to his probation officer that day, or contact Casa Esperanza. He was arrested again on June 7th, less than a month after his release, and is still in custody. During his brief respite from incarceration, he committed burglary, lost his wallet, his ID, several pairs of shoes, all the money he received from his tax return for he worked the year before, his clothes, he attempted robbery, lost sleep, slept in the open, bummed food, tried to fight with our pastor, and this is very out of character. Aside from the lack of beds for those released, there is a break in the communication bridge between our courts and law enforcement. There is a fracture in the middle of that bridge, dropping the ones who need it most into the troubled waters below.
Thank you very much. Supervisor Gray, your light's on. Did you have a comment yet? Okay, thanks.
McNeil Sabry, my apologies if I got that pronunciation incorrect, to be followed by Agris Petersons.
That's okay, I'll correct the pronunciation. Good morning, Madam Chair and members of the board. My name is Sayer McNeil. I'm a solo practitioner attorney in town. As you can see from my prominent sign, I'm advocating on behalf of Families Act, and we advocate for compassionate treatment of the homeless, mentally ill, and duly diagnosed. The most compassionate solution is also the most cost-effective solution, and I know from some comments at the hearing on the 2011 Public Safety Realignment Act that you understand this. A few months ago, the county CEO produced a report comparing the cost of incarceration with stabilizing services, and their conclusion was that the cost of incarcerating a homeless person with mental illness is estimated to be at least 25% more than providing supportive services. Supportive services are defined to be housing, medical care, substance abuse, and mental health treatment. Subsequent discussions with the CEO have revealed that this estimate does not include hard-to-quantify additional incarceration costs, such as arrest, booking, transportation, etc. Our concern is that, expressed by Supervisor Farr at the hearing on the 2011 Public Safety Realignment, we need to allocate funds for direct services. According to this report, housing is the most important stabilizing service required to assist the homeless mentally ill individuals to prevent them from reoffending and from returning to jail. The effectiveness of treatment is directly proportional to the stability of housing. We understand that the capital cost is a significant barrier to changing this revolving door situation. However, the county is setting aside $1 million a year toward construction of a new jail. We would like to see them set aside money towards comprehensive, effective housing for the homeless mentally ill. Thank you.
Thank you. Thank you for being here. Supervisor Gray?
I have a quick question for you, sir.
Excuse me, if you could come back to the podium.
Yes, thank you.
Just a real quick answer. Does your group have an estimate of how many beds were short? I mean, I hear we're short. I got that, but I'm wondering about a number.
I don't personally have that number. There may be someone else here
And
who
I'll
does,
ask the administration too, but I just had heard so many people talk about this, I wondered if there was some kind of estimation.
I don't have that at the tip of my tongue. Thank you.
Agris Petersons, to be followed by Jeff Bard.
Good morning, Supervisor Chair and Supervisor. My name is Agris Petersons. I'm a licensed social worker, and I worked for the county since '72 and retired in '99. And before that, I worked 4 years with the state. I was involved in getting people out of the state hospitals, I mean, almost directly, well, very directly, into the community. And I can remember in the '70s, Santa Barbara was a model mental health program. We had 5 clinics in the South Coast area. We had 3-day treatments. We had a range of board and care. We had board and care homes, residential care homes, room and boards, a variety of settings. And it was one of our best programs. I've gone recently, after retiring, I've been working at the PUF very briefly, just to help out, and also at ACT program. And what I find, it's really all the things that have been mentioned here about the need for the beds. I worked on the psych unit, and the staff does their best. But what happens when people get in, you know, you've got a maximum of people in. You can't get them out. Just you treat them, and they need a place to go. Where do they go? There's nothing for them to go to, so they end up keeping them on administrative leave because they're not going to kick them out in the street, although sometimes that happens. And what I'm advocating for is we need not only to keep the psychiatric beds, but make sure that there are other beds, because even within the ACT program, the Assertive Community Treatment Program, when I went to see people we were preventing hospitalization. Yes, we were preventing hospitalization, but people ended up in motels temporarily because there was no place to go. And they were 3 or 4 days in a motel. The manager calls and says the place is being torn up. Get him out of here. You know, so that's not an appropriate place. People end up in hotels, the Falding Hotel and other hotels. They need more supervision. We try to provide it, but there's not enough staff to provide adequate support where the person can continue to stay there. So it's a very, and the reason I'm here tonight, I went to the FACT meeting last night, and I almost started crying because the parents are suffering so much and cannot get help for their kids.
Thank you
Cottage
so much.
Hospital also needs to be part of the solution.
Thank you.
Okay, thank you.
Appreciate your comments, sir.
Jeff Bard to be followed by Onya Lawson.
Madam Chair, members of the board, you can't do this in 2 minutes. I really need 10, so I'll try to talk fast. Basically, I'm putting together what will probably be 501c3, teach everywhere about community health, and there are multiple campaigns under that, including facilitating prevention rather than post hoc treatment of morbidity and mortality amongst the homeless. And Dr. Wada did a great job, but we didn't hear about the health care for the homeless program, and I'd like to make sure that's fully funded, and I'd like to see it expanded and create an office of prevention, probably at the federal level, but basically so that we can not have to pay for homeless people that have emphysema, bronchitis, and lung cancer. And as it is right now, we're far too permissive with smoking at the homeless shelters and in the treatment programs. I realize some homeless people do need to smoke because they have very complicated issues with medications that they're on. But the rule should be, if you go visit the shelter, you don't have to go through a big cloud of smoke, and there are a lot of social reasons why that's still a problem I'm working on. I'm also trying to get service dogs for post-traumatic syndrome veterans permissive. It wouldn't cost us a penny, and I'm trying to get martial arts training for homeless women and frail elderly. And my brother owns a martial arts studio in the LA area, so I'm trying to get something going on that. Now, I totally support the comments to keep the PUF going. We got to keep the PUF there. You know, we get very stingy. While I was on my way to church or not go to church, my enthusiasm was a low ebb that Sunday morning. And I saw a woman changing a tire with 2 small children. So I thought, the perfect excuse to not go to church. And so I helped change, actually there's 2 tires, because as it turned out, her husband had decompensated. This woman was from Seattle, and they were down in a rented car, and her husband was, guess where? He was in the PUF, suicide attempt. Imagine being 1,000 miles from home with 2 kids, a rental car, and your husband's in the PUF. So thank God for the PUF. Let's not be too stingy, okay? I totally concur with everyone here who's arguing to keep the PUF there. We need more, not less. Thank you.
Thank you, Mr. Bard.
Onya Lawson to be followed by Valerie Stevens.
Good morning. While I appreciate the revision that ADMHS has made, needless to say, we need to have more beds rather than a reduction of beds, particularly at the PUF, and some of them could be at North County. Also, we need to maintain the beds at Vista Del Mar. That being said, I'm primarily here to read a letter from someone who's not able to be here, and my own personal thoughts and issues I've sent to you in an email and also in a letter form with my signature on it. This is from Lisa Donai. I regret that I cannot join you for the budget meeting this morning, but my work schedule prevents me from meeting you where you are. I trust my community colleagues will share what I have written, knowing this comes from the heart and the mind of a concerned citizen. My daughter has been suffering tragically for 7 years with physical and psychological consequences of the terrible and sudden onset of bipolar disorder. Although her story is not common, it is an important example of how the lack of facilities and resources for her in times of crisis has continued to put her and now her children at risk. Most recently, at the beginning of May, she had a severe psychotic breakdown that rendered her unable to care for herself or her two small children, both under the age of 4. She was 5150'd after screaming, ranting, and being totally out of reality for 2 days, held at Vista Del Mar for only 6 days. She was released and then, like so many other times, readmitted for exactly the same reason: psychological instability and continued psychosis. When her second hold ran out, Vista said they would release her and that readmittance would be likely, but her time was up. There isn't enough room to treat them all. They have often told me. Luckily, after days of phone calls, the transition plan to have her transferred to the PUF was put in place. I breathe a sign of relief, as I falsely believed that she would have more time to stabilize before going home
Thank
to
you.
her children.
I'm sorry.
Okay, thank you.
Thank you. Thank you for being here.
Our next speaker is Valerie Stevens, to be followed by Debbie Ulrich.
Madam Chair and members of the board, I'm Valerie Stevens with New Hope for Troubled Lives. When I lived in Santa Barbara a few years ago, I had a friend whose sister was mentally ill. When the facility she was in was closed down, she was forced to be on the streets. She didn't know how to take care of herself and had no means of doing so. So she discovered that by committing a crime, she could be put in prison or jail and taken care of there. So this became a pattern of getting out of jail, committing a crime, going back in again. It seems to me not only that it's more expensive to do it that way than it would be to provide for their care, and it's also much more compassionate. So I would urge you to take that into consideration. Thank you.
Thank you.
Debbie Ulrich, to be followed by Mr. Caldwell, who will be our final speaker.
Hi, thank you so much for your time. I'm Debbie Ulrich. I'm a licensed marriage and family therapist. I live in the North County, and I just wanted to address a situation that's hit really close to home. Our son, Zachary, was an excellent student at San Ynez High School and a top athlete. And he was someone who had never been in trouble before. He never even had a traffic ticket. But 2.5 years ago, at the age of 19, he began experiencing hallucinations and delusions. And my husband and I were seeking treatment. And as we were trying to get the right combo of antipsychotic meds, he experienced a manic psychotic episode and broke the law. And so he went to jail, and we were led to believe during this whole 9-month process that he was going to eventually receive treatment over incarceration. And then about 4 days before the disposition on the case, the DA had a change of heart, and he ended up receiving a 5-year sentence. And when he went for evaluations at Wasco, they deemed that he had no mental health issues, and they sent him to prison, even though he had had multiple evaluations privately and while in the jail, that they said he would benefit with treatment over incarceration. So he's in prison right now serving 5 years with no mental health treatment whatsoever, and he's in a single cell, 5 feet by 6, that he shares with another person. And I think with all the overcrowding, it just seems such an injustice. And I wasn't planning on saying this, but I was talking to the DAs, and like right at the very end, the DA said, 5 years from now, you're going to come back and thank me. And, at this point, I can't see that that's going to happen. But I just urge you for my personal thing is treatment over incarceration. Thanks so much.
Thank you. Thank you for your testimony.
Mr. Caldwell.
Madam Chair, members of the board, Andy Caldwell representing CoLab. Some people have mentioned the new jail. I think that's a red herring as a result of the fact that the state's going to pay for the bulk of that. However, I do think they ought to know that the county opted to spend $14 million on the Emergency Operations Center, which did not meet a pressing need in most people's opinion. One of the things that, again, is absent from this discussion is privatization. For instance, alcohol, drug, and mental health spends $70 million a year. $38 million of that is on salaries and benefits, benefits being more than 50% of the cost of the salaries. If you privatize that department, you could have more funds for things like the PUF. The other thing, I'm hoping that the veterans that have showed up early here will recognize that your county is going to spend approximately $500,000 on a smoking cessation program that has abysmal results, i.e. it can prove very few people quit smoking as a result of throwing that much money, but you want to cut veteran services to $178,000 a year. Animal services, by contrast, gets $3.8 million a year. Who's more important, our vets? I think you know the answer to that. On poverty, 77% of CalWORKs, 74% of CalFresh, 73% of General Relief, and 71% of your Medi-Cal cases are all in the North County. And yet this board continues to stand in the way of those people in the North County and those projects that would invest today in projects to help the poverty rates, including the unemployment rates of 13.8 in Santa Maria, 15.5% in Lompoc, and Guadalupe with 15.1%. As you know, I protest being limited to 2 minutes in trying to cover 5 departments. You do not need to run these budget hearings this well. The public is more important than this, than for you to jam this into 2 days of hearings. Thank you.
Thank you, Mr. Caldwell. And I want to thank everybody. Who comes to speak, and particularly all of you that are here today to speak on these issues. Clearly, they are of critical importance to our county, to the people of our county, and I realize that it's also a very personal and a very emotional issue. So thank you all for being here and for sharing your testimony with us. All right, that concludes this particular part of our public comment on the departmental budgets. We'll take about 2 minutes and we'll move into our next section here where we're going to start to hear from support services, starting with the Auditor Controller.